So today we were talking about a fairly controversial topic, and that is the outcomes of transgender surgery in adults, not kids, strictly adults. And a brand new study came out looking at the potential mental health risks. Now, we did a segment on the potential benefits of transgender surgery for gender dysphoria in adults a couple years ago, and I pulled a bunch of studies, and the conclusion of those studies was that overall patients' mental health was improved, and so that's what I've kind of historically said. Well, this new study just came out a couple days ago, and what's interesting is it's a very big study. The study had over 100,000 patients in it versus these previous studies I looked at that were much smaller, maybe dozens or 100 patients. And the results were pretty surprising because they were almost in the exact opposite of what the studies in the past said. This one showed increased rates of depression, anxiety, and suicidal ideation, as well as substance use disorders in patients with gender dysphoria who did surgery versus patients who had gender dysphoria that didn't do surgery. And that's pretty wild because this definitely goes against all these other studies that have been used to kind of counsel patients on, should you have the surgery or not. And so I think this is kind of a big deal because one, it's in complete contradiction of what a lot of doctors have been saying. And I think that definitely people are going to be talking about this one. Sarah brought up the point that maybe it's a difference in the generation because these other studies were older and now there's a lot more people doing it. Maybe that's having an effect for why there's a change in the mental health outcomes. But pretty big stuff. I think we're going to see a lot about this one in the news because unfortunately this topic has gotten politicized and people are going to be talking about this. So at the end of the day, we just hope that we can get the best information for patients so they can make the right decisions.